I first want to acknowledge the traditional custodians of the lands in which we are gathering on for the seminar today, the Ngunnawal and Ngambri people, for those of us on campus, and pay my respects to their elders past and present, and also welcome any Aboriginal and Torres Strait Islander peoples with us today, both in person and online. Dr. Danish Ahmad is joining us today. He's trained in clinical medicine from the University of Delhi and public health from the University of Oxford and the University of Canberra. Danish's focus is in improving the design, delivery and evaluation of health systems to improve population health and well-being. He's a global health researcher and population health lecturer in SMP. And as an educator, he's passionate about supporting public health competency development and exploring teaching research to enhance learning and peer-to-peer international engagement. And today he's going to talk to us about showcasing an online global health teaching pedagogy for peer-to-peer engagement in real time. A round of applause.
Thank you. Thanks, everybody, and thank Nicole and Joe for having me here. The flip side of universities is, of course, teaching, and it's a bit hard to beat a presentation on AI and imposters. Now, the piece that I'm presenting comes from a teaching research grant that I was awarded. And through the course of the teaching research grant, I was able to design, develop, and implement an online module, which essentially allowed for more peer-to-peer international student exchange online. Now, this work was also developed with collaborators at the University of Canberra and international collaborators in India that were based at the Indian Institute of Public Health, Gandhinagar. Now, my own experiences as a student through different countries sort of showed through that sometimes lived experience doesn't always flow through our educational content. And global health is a very interesting space because some of the contemporary challenges that we face today aren't necessarily solvable with the skills and competencies that we have. The other challenge of global health typically is that when we learn about what's happening in different countries, the content and material that's produced comes from a deficit model. Often when we think about diseases, and if you look at the distribution of diseases, it gets painted as an issue of low resource settings, and often funding being the main constraint, which isn't necessarily true. If you reflect about high-income countries and low-resource settings within high-income countries, we have the same issues. And building cultural awareness and competencies in students who might be working in global health allows them to think of solutions slightly differently. So, oops, sorry. I might just...
Yeah.
Keyboard, yeah.
Yeah, straight up, plug it up. Okay, yeah.
How much
Just
is
the keyboard work.
Oh, perfect. This work sort of acknowledges that cultural differences amongst students in different settings can both be a learning experience for them, but often the issue is how do we bring that lived experience into an online space? Now, I'm going to also show us some of the slides that we've used in our online virtual module to explain how culture can often have collateral or similar presentations. So for example, in Australia, we often start with an acknowledgement of country. And in India, we often have an equivalent cultural custom of lighting a lamp. And the cultural context of that is the lighting of the lamp is meant to signify light defeating darkness and creating more knowledge. Now, for us within this experience, we were really guided by a couple of things. And I'm going to do the opposite today and sort of tell you what we did first, why we did it and how we did it, and what some of the outcomes related to that experience was. Now, in terms of who was participating, this initiative was designed between universities, ANU-SMP, University of Canberra, the Faculty of Public Health, and the Public Health Foundation of India, which is India's leading public health organization. And we were able to leverage a pre-existing relationship that PHFI had with the University of Canberra to later develop this online teaching module. So PHFI and its teaching institute, one of which is in the west of India, which is right across there, about 17 hours by flight from here, in Gandhinagar, they do exclusively courses in public health. So in terms of their focus and where this online module was focused, it had strong alignment. Now, the genesis of it started as a teaching research grant that I was awarded. And I was teaching global health initially at the University of Canberra before I transferred over to ANU. Now, global health is fantastic for some of the reasons that it allows us to look at what's happening in different countries. But as I shared, the way it's traditionally taught in classrooms, it doesn't always allow peers to experience what's happening in a different country or a different context. So there was a real sense of thinking through of creating an online module which best replicated some of the benefits of perhaps a virtual internship, which has become more prominent after COVID, as well as some elements of study abroad programs. Now, traditionally, most universities that offer study abroad programs for students also have equity issues. If you think about who in a university is able to access a study abroad program, it limits participation. And at the same time, virtual internships, which grew after COVID, allow people to experience some aspects of learning, but again, they tend to be slightly expensive. So the back end of this module, we were trying to bring together classroom teaching of global health, but engage with international students through a new online module, which would allow peers to come together and engage with each other through a new type of learning theory. And so essentially in 2022, we ran through 4 sessions of a tutorial style session where the focus was to demonstrate the implementation feasibility of a virtual practice-based module, which would supplement classroom teaching. And essentially to show this as a proof of concept, which could be replicated for other courses, but also potentially be replicated by other universities. And the idea behind it was to do it in a manner in which it was low cost, flexible, and allowed pre-existing technologies. So when this module was developed, we had a team that comprised of public health professionals. We had an educational designer who was guiding on the pedagogy. And there was a real sense of using existing technology that was freely available, which didn't require a lot of initial cost investment or training for universities to participate in. So we used Zoom, which was quite easily available, Google, and Padlet, which is fantastic for bringing in classroom feedback and individual feedback, and Canva. Now, across 10 hours that across 10 hours total that the 4 sessions ran, we spent about $200 in all for the module, and that's why it tends to be low cost outside of in-kind contribution of people who are involved. Now, this module also leaned on a theory of teaching, which is called the constructive learning theory, which essentially recognizes that knowledge is created more through lived experience and active learning by people. And we wanted to really use constructive learning theory as a way for peers in different countries to come together, but not be faced by a lack of knowledge across the boundary. So to really bring in their own lived experience, their own understanding of health and culture, and then see how they could co-create a better understanding of some of the contemporary challenges that they were facing in their respective countries. Now, this was delivered to over 100 students who were doing Masters of Public Health at the University of Canberra and the Indian Institute of Public Health, Gandhinagar. And we had about 12 staff facilitating the session. Now, that's a slightly big number. And we sort of came to 12 because when we were creating the module, we were trying to have one person per breakout room in Zoom And that's where most of the student interaction happened. Now, the facilitators didn't have an active role. They were staff, but they had more of a moderation role just to encourage students to engage with each other and just to give them some slight guidance. And the idea there was essentially to use some theories and some examples of case study approaches through which students were able to bring their experiences of what they were seeing in health issues across the different health systems. Now, what we really wanted to achieve by the end of it was to sort of develop a way for students to be able to engage with each other, to have authentic cross-cultural learning from each other, and for it to be sustainable within an existing unit. And often, when such programs are introduced, it also poses a time commitment for students where they aren't able to participate. So this module replaced existing tutorial in the semester, and we co-created and co-designed a new way to run sessions. Now, at the outset, what was different about this as opposed to a traditional classroom lecture was the focus of how do you bring together students in a different country together and create a setting where they can be relatively comfortable with each other. For a moment, if you imagine ever walking into a room where you don't know anybody, it's a bit confronting. And you can bring people together, but often creating those moments of interaction where there's slight comfort to talk and engage in a cross-cultural setting is really, really hard. So a lot of thought was put in to establish these 4 linked sessions. And these 4 linked sessions comprise the online virtual module, which supplemented traditional classroom teaching that was happening and allowed 2 universities to come together in an online space, interact freely, and have cultural exchange. Now, the sequence of the tutorials just shows how we structured or staggered the content. We really did start off as a practice pilot training session where we trialed the technology while we trialed how it would work out within Zoom, within breakout rooms and using different technologies. And then we introduced various elements of knowledge, skill, and application. Now, I wouldn't get into the nitty-gritties of what happened, but it was more about being able to use something that we already do, but do it differently in a way that it worked better. And a lot of the thinking actually went through creating templates for each of the sessions that would allow facilitators from different universities in different time zones to be able to work together and also have large groups of students to be guided in a virtual environment, which can be a bit challenging. So each of the sessions essentially had the same structure where when each Zoom session started, we had a main room activity where the content was explained, and often modeling of behaviors and modeling of knowledge was done between facilitators in the main room over a relatively short period. And that allowed students to also gain from expert advice. And then students were asked to go into breakout rooms, which were mixed breakout rooms, and kept the same for the duration of the virtual module. And that's where most of the student interaction and engagement happened. And by the end of it, depending on different activities that they were doing, they were asked to come back to the main room and share their reflections and insights based on what was scheduled. So this sort of illustrates the movement between the main room, the breakout room, and within the breakout room, often we use Padlet, which is a fantastic software where students can put up their pictures, their photographs, their comments, and then they can use it within a group. And by the end of the breakout room discussion, they were invited back to the main room for broader reflection and thinking. Now, this is just an example of the level of detail we had to go through depending on the topic that we were thinking of to really create fixed learning aims for each part of the 2-hour online session. So even in the first 15 minutes when people were in the main room, we really had to model specific expectations and then give students a chance to see what was being done in Australia for a specific health condition. And here I've got a slide where an Australian facilitator spoke about mental health promotion activities. And this was complemented by an Indian facilitator who was talking about what happens in India. Now, this initial content was described by academics. It was meant to create behaviors and to show students the type of content we wanted them to think about when they were in their own individual breakout rooms. And when they were in their own breakout rooms, students were asked before to come up with either interviews or photographs linked to what they were experiencing in terms of culture in the healthcare system. And this is an example of pictures being put up and Padlet in one of the breakout rooms where students from both universities put up pictures and had discussions on what the pictures meant for them as a reflection of peer experience. Now, the breakout room sessions weren't moderated by staff. They were there on their own. And over a period of 4 weeks, that's where most of the interaction and engagement happened. And we were asking students in those groups to self-nominate 2 pictures or 2 reflections that they wanted to bring back to the main room. And there were themes linked to each of the activities for each of the 4 specific sessions that allowed students to tap into different aspects of engagement. And at the same time, we were also trying to show what was happening in the 2 cities at the same calendar period. And this sort of happened between September and October in 2022 when we had Floriad here. At the same time in India, the state of Gujarat, there was a cultural festival called Garba, which is typically a dance festival where couples often get together and dance with sticks. That's a simplified version. And by the end of it, on the skill development aspect of the module, we had provided students with case studies linked to contemporary public health issues, both in Australia and India, where we wanted them to come back and try to think about potential solutions to these using the new knowledge they had gained. And one of the ways this was drummed up to be more exciting was to invite expert international guest audience as guest audience to sort of judge posters that students did in their groups. Now, in the online space, we'd asked students to work through pre-filled templates and populate their thinking about these specific issues and worked in mixed group to come up with various solutions linked to the problem that we were talking about. And this is an example of a poster that was filled. What we had created were templates, blank templates with just broad headings, and mixed student groups were then working through together to come up with potential solutions. And as I said, we had international guest audience who were visiting the final session. And by the end, also as a form of encouragement, we had designed certificates for students, depending on how much they participated, if they had attended most of the sessions or less. And we evaluated this module using an international validated questionnaire that gave us key domains in terms of engagement, learning, motivation. And some of those details are also used to populate a paper that I'll provide a link about. Now, in terms of putting all of this together, it took a fair bit of time. It took about 1 month to think through the pedagogy, 1 month to coordinate with international partners, and to come up with these templates that I showed us. These templates really allowed for each session to flow through relatively easily, but it was coming through and thinking about how do you actually design sessions that allow people to feel more comfortably and work well with each other. And we sort of know from the implementation phase, when this was being run, we had process evaluation being conducted after each session, again through Padlet, where students were giving anonymous feedback that was telling us what they liked, what they didn't like, and we were really acting on it in each session to improve it. And by the end, students did a voluntary anonymous Qualtrics survey based on a quantitative survey where we measured outcome across 4 key domains, which showed an overall high impact. Now, coming back with what we were trying to achieve and what we learned, this initiative was really useful for a couple of things. And the key ones are highlighted here. One, it allowed us to have stronger relationships between 2 universities that share a very close relationship already and are just geographically separated. This was also an example of a trilateral collaboration between the Australian National University, University of Canberra, and an Indian university working together to teach their students over areas of mutual interest. But in the development of the module and the pedagogy, all of the facilitators who are academic also had a chance to learn about a new way to teach and also to use new technology. And it had a component of staff capacity building as well. And ultimately, student engagement, international cultural exposure, and a way to think differently about health systems was really prioritized. Now, I reflect again that often in universities, teaching research isn't prioritized or isn't always given the same space as other research. I was fortunate to have mentors that encouraged me to look at teaching research initially as a way to improve certainly pedagogy, but also as a way to fit my own lived experience and my competencies in global health. And this initiative then did have relative success. It achieved a University Excellence Award in 2022. It culminated in a paper, also formed a case study for a higher education fellowship. And this year, University of Canberra is extending this module for other courses. And there are ideas at play to try and introduce it next year within SMP. Now, details of how this was done are also available in this paper. And there were a lot of people involved in this initiative. And a lot of the focus essentially it came back to the template, to the delivery. And that's why I was showing us those initial templates, because that allowed for seamless transition through the 4 sessions. So that's all for I-PELICAN. I think it was a really fantastic experience. As I said, from our experience, it was relatively easy to do because we had the experience, we sort of learn from each other, and it allows us to show a way to do international peer-to-peer exchange online at a relatively low cost. So thank you.
Thank you so much. That was really, really cool. I love the idea of doing that cross-cultural, exchange between the students. I just have a couple of questions about, you said that you're trying to get this up in 2024. Are you having those discussions for here at ANU? Is that in the undergraduate program or in MCHD?
Yeah, so it's not been concretized yet because I teach into the MCHD program. That's where the intent would be, but to then curate it for medical schools in different countries.
Sure.
One of the challenges with medical programs is they tend to be more circumscribed in their content, and the breadth of what we can introduce for cross-cultural exchange tends to be shaped differently.
Yeah. I think there could be a lot of utility in some of the undergraduate programs. Just coming back from Malaysia the other week, doing something like this would be amazing. I think there's a lot of appetite there across different areas as well. So that might be something to talk about in the future. But also, I guess my second question, and you might not be able to answer that now that I know you're kind of still at the very beginning stages of that, but the policy and procedures around teaching and education and actually managing a cross-cultural across different nations classroom. I just wondered how that works going through the AAU process, but that's something that maybe you're still working in.
Yeah, I am. I think, as I said, one thing that really helped us was UC had a pre-existing relationship with this institution, and we were able to leverage it. At ANU, I think, again, often it is collaborators in different countries who are willing to do it. The time difference is often a challenge that limits where you can do it. But reflecting on study abroad programs, there was an idea of using this as a precursor before a real study abroad visit, because it allowed for some contextual information knowledge to then base an actual visit.
Thank you. Really cool. Thank you.
Yeah, thanks, Nicole. Can I ask? Yeah. So I think what I might be interested to generally ask people is what their ideas or experiences are when they're trying to bring international students together online, what sort of worked well in your experience if you were doing something like this? So if you, for your courses, if you wanted to invite, say, students doing the same course, but a different university, short of inviting them to a Zoom session, where engagement often is very different, has there been any experience or suggestions that I can take on board? If they are, it's good. If not, I'd be really happy to listen in. And I've got my email up there.
Danish, different circumstances. For example, our MCHD student has students that join us in third year from Malaysia, and culturally there's some very different backgrounds, and so you can almost do this project in situ here. Have you thought about, with international students coming and doing this same type of activity, but here?
In person within a classroom? That's fantastic. We haven't yet, and that's certainly something that would be a natural extension of this. But one of the extensions there would be really trying to tap into what people were seeing in their own countries before they came in. We could, I think, introduce some elements of this in our sessions.
Yeah, even the students before they arrive as a sort of an exercise activity before they actually they know they're coming to Australia to study, to actually give them this sort of experience beforehand.
Yeah. Thank you. I think that's something to be considered more strongly.
I guess on that point as well, what about, we get a lot of international students coming for research, not just for undergraduate or MCHD. What about engaging students in honours and PhDs with other researchers in other countries? I don't know, because there's a lot of research, it's very typical for people to be moving around a lot, but a lot of the time I don't think there's that community before we go on exchange or go to tackle research.
Yeah, for sure. I think there's that, and I think where what we sort of learned what might work differently for different people, different contexts, is that scaffolding. How do you run a session where that engagement happens? And we've tried it for one set of people and seen that it works, but you're absolutely right. It does need to be tried for more groups, tried and seen what works for different audiences. Perfect. So I want to thank everybody for their attention and listening in, and for your great suggestions.